You're watching Salam Namaste Singapore Season 4. In this segment, it's going to be very interesting and very informative. I have Dr. Devinder Singh, who is a senior consultant, cardiologist and an electrophysiologist. Dr. Devinder, welcome to Salam Namaste Singapore.
Thank you very much, and it's a pleasure meeting you, Vinay.
Pleasure is mine as well, and I'm super excited to talk to you about one of the most Googled topics on this earth, which is cardiac health. Heart's so important for us all to function, and what this pandemic has taught us is the importance of health. So if you can shed some light on cardiac health, what exactly is a good cardiac health?
Yeah, that's a very good question. I would say once you turn 40, everybody should get a yearly health screening. Not having hypertension, your cholesterol is controlled, you don't have diabetes. All these are risk factors that can lead to heart problem.
Right.
So having a good cardiac health means controlling those things or preventing those things that can lead to heart problem.
Right. So are you trying to say that, blood pressure, cholesterol are the symptoms that your heart health is not that good?
The reason we get heart problem is because of certain risk factors.
Right.
There are certain things that you can change and certain things that you can't change.
Yeah.
So genetics is something which we can't change. We can't change what we got from our parents. Hereditary. But what we can change is our lifestyle.
Right.
If you are not smoking, if your blood pressure is well controlled, if your cholesterol is good, if you don't have diabetes, your chances of having heart problem lowers significantly.
Right.
And when we talk about cardiac health, it's basically to prevent those risk factors that can lead to cardiac problems.
According to you, right, what are the top 3 things or tips rather, that people can keep in mind and do on their daily lives to have a good cardiac health?
Number 1, I would say, is to exercise regularly. Secondly, lifestyle is
very important.
Very important is don't smoke.
Right.
Smoking is one of the biggest risk factor for cardiac problems, especially heart attack. And the benefits goes beyond heart attack. It can prevent cancers, it can prevent stroke as well. Third thing I would say is, as I mentioned earlier, is regular screening. And
there is this one thing that I keep reading online, people posting on social media, oh, I had palpitation. It's a term that now people are starting to use very frequently. What exactly is palpitation? Is that a concern that your heart is not okay?
In simple term, palpitation means feeling your own heartbeat.
Right.
You must have felt, if you suddenly have to run or catch a bus, you might feel your heart thumping inside.
Yeah.
That is palpitation. But when you start feeling this, when you are not supposed to feel, like you are relaxed, watching TV, and suddenly you feel your heart is racing, that's a problem. That's a problem. So that is abnormal palpitation.
How do you know that you have a cardiac arrest?
So cardiac arrest means your heart has stopped. It could stop from a heart attack. It could stop from an electrical problem where the heart suddenly stops beating, and it is the most common cause of sudden death. And it's a very serious condition. There are ways where you can tell a person is at risk of dying suddenly. There are certain pointers in history, like a person having a family history of heart problem. That means his parents having heart problem at a younger age. So these are the pointers that they may be at risk of having sudden cardiac arrest in future. If patient has hypertension, diabetes, raised cholesterol, he's a smoker. That means the combination of risk factors are there. That kind of, you can say, a recipe for having a heart attack. They are also at risk of having a cardiac arrest. But once a person gets cardiac arrest, it's not something that he can help himself at that point, because that is a point where a person who is watching him or is with him can help him or save his life. So I think if you're worried about cardiac arrest, we don't have to wait until we get cardiac arrest. We have to actually prevent those factors that can lead to cardiac arrest.
And that's when regular tests help.
Correct.
If there is a blockage, if there is an issue, we'll always get to know earlier.
Sure, yeah.
If there is a cardiac arrest, what are the symptoms that somebody with a person who's having a cardiac arrest can identify?
There are certain pointer or symptoms like easy fatigue, getting shortness of breath from doing activities which you could easily do, getting chest discomfort, spontaneous palpitation without any reasons. That means you feel your heart is racing without any provocation. All these are factors that tells that your heart health is not good. and it's something that needs attention. So instead of waiting on these symptoms and letting things get worse, it is better to seek medical care or attention when you start feeling these symptoms.
And if somebody has got cardiac arrest, then is it the first thing that happens is breathlessness?
The first thing which might happen with a cardiac arrest could be sudden death. That means the person can suddenly collapse. But chest pain may be the most common precursor. So that means, because as I mentioned, heart attack or blockage in your heart arteries leading to heart attack, which eventually leads to cardiac arrest, is the most common scenario of cardiac arrest. So if a person gets discomfort, tightness, or a sensation of pressure on his chest with cold sweats, pain going down his arms, like a typical scenario of having a heart attack, that is a precursor of cardiac arrest. And this is the time when you should call ambulance, not wait. And I would suggest that nobody should drive to hospital or ask their family members to bring them to hospital if they're having these symptoms, because if something happens on the way, nobody can help.
Ambulance is better.
Ambulance is the best. It can save life.
Right. Another thing that I've always had this confusion that people always say when they have a little bit of chest discomfort, they will say this is gastritis.
Sometimes it may not be very easy to differentiate whether your symptoms, you are feeling this burning in your chest, whether is it gastritis or is it heart problem. But I would still say that we shouldn't ignore, and we shouldn't discard symptoms in our chest as being, that you ate heavy meal, or this is not a heart problem and it will go away. Even if it is gastritis, the doctor can help differentiate. There are certain simple tests we can do. Just doing an ECG can differentiate whether your discomfort is coming from your heart or your stomach.
Lastly, I can see this mock-up heart in front of us. When there is a cardiac arrest or a blockage, what exactly happens in the heart?
You can see this is a heart model, and these tiny red lines are heart arteries. So they supply oxygenated blood to the heart muscles, and when we talk about heart attack, there is sudden blockage or clot formation in these arteries, and if that occurs, there is lack of blood supply to the heart muscles, leading to scarring or death of heart muscles, which is basically heart attack.
It was wonderful talking to you about cardiac arrest and heart health. I think this is the most important thing that people should be aware of. Being aware will help in terms of a lot more issues that can happen in the long term. And one of the common things that people do is go Google. So I think it's important to understand and seek medical help if there's anything. So lovely talking to you, and I can't wait to have you back again to talk about the solutions for cardiac health.
Thank you.
So that's it in this segment. What we learned, it was what is cardiac health, what are the tips that you need to keep in mind to have a good cardiac health, what are the things that you should watch out for if there is a symptom, if there is an issue in your heart health. So don't ignore. I'm going to take a short break and come back again. You don't go anywhere. This is Vinay Bharadwaj. You're watching Salam Namaste Singapore Season 4.
Terima kasih telah menyaksikan video ini, dan jangan lewatkan video menarik lainnya dari channel Tekon TV. Sampai jumpa di video selanjutnya. Stay healthy with Tekon TV.